or 2.5 million, and they're fairly wealthy. But if you look at NCR, during the day you have a population of 24 million, and at night you have a population of 18 million. All right? That's more than most of the countries put together, right? Out of which only 3 million people can actually afford healthcare of any kind, right? And that itself is a huge issue to begin with. Now, when we see that even though there's an increase in resource allocation because of the rising population and a percentage of GDP, the actual allocation amount has dwindled. And then, like in a lot of other countries, most of the actual implementation, which was brought out by our previous speaker, is at the state level. So even though the funds at a central level are allocated, if the state doesn't actually allocate them or implement them and making sure that they actually happen, it doesn't happen. And I'm sure if there, at a question and answer, I'm sure she'll be able to enlighten us about the NRHM funds, which are not actually implemented or even used in a lot of states. And even now, the growth is occurring in the private healthcare sector. And what I've just told you is that private healthcare center is not people of large corporate hospitals. It's people who set up a 20-bed, 30-bed, 15-bed nursing home, which is what you see all over the country. Or you have these labs which are not accredited, which are all over the country. All right? And those are, they're real implications, and nobody really looks at it. Okay, something is better than nothing, but I think in healthcare, dangerous something is worse than nothing. So it's something which is important for us to look at from that perspective. So I do believe that there's a strong need for private-public partnerships because I think that can increase the, or let's say increase the opportunity to use our limited resources as they are in a very efficient and effective manner to be able to provide care. NRHM has created a lot of diagnostic centers all over the country. Most of them are not manned, they're equipped. Perhaps there's an opportunity for mobile electronic transfer of data to places which do have the manpower so that they can at least provide the proper interpretation of those tests. Good opportunity. Needs to be looked at and is being done in some states. When we look at PPP modalities, for those of you who've been in government and those of you who've been in the private sector and those of you who've been to a variety of healthcare conferences, this thing has been talked around for the last 5 years, right? PPP, 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 till we are going down to death, right? And you have Deloitte and Touche and KPMG and Ernst & Young and Price Waterhouse, and you name all the consulting firms are involved with some state government or the other, trying to get them to fix this PPP project. Right? And for some reason, nobody seems to understand how to fix it. Now, we have certain solutions. I have certain solutions. I think it's a very simple thing. Healthcare is very complex, and we've got to make solutions very simple so that they can be actually implemented. So you can have something which is fully public, which is what we're used to, and something which is fully private, and then a whole bunch of things in between. Now, the success of any partnership, all right, is that the two partners should respect each other and there should be a mutual understanding for having mutual benefits. That, I think, is primary responsibility, right? There must be a strong need for community support for both partners, right? That is both private and public, all right? The obligation should be clear. Obviously, it helps if you have a stable political government and a legal environment. And the regulatory framework should be followed. There should be a strong management information center because that way you can at least have the ability to be as transparent as possible. And there should be clear incentives and penalties if one deviates from the area which we can, all right? If one creates that framework, no one on the private sector or public sector will ever do something willingly which will create an issue or a problem if there's transparency. And as long as there's effectiveness, there's efficiency, there's equity, and all of us have investors. We don't grow money. We don't have the advantage that the government sometimes have to be able to print money or to raise taxes. So we have to pay our investors back. And it's a simple equation. If an investor can get more money by investing in a bank, he wouldn't invest it in an industry. So we've got to be able to give them a return which is slightly higher than what it would be from a bank. And because there is the importance about healthcare is the corporate social responsibility which goes along with that. So it has to be combined with the fact that if we believe that these four aspects should be put in a place, a PPP can easily work. We've had an opportunity, and I'll tell you about that in a second, to set up 2 PPP projects. Very simple. So the advantages of PPP to the society are that one can now provide a high quality of service at affordable prices. You possibly have efficient management, and I always leave that possible by saying possible, because not all private players are efficient managers. Some of them are as bad as public or worse than public players. Public doesn't have accountability. You have to spend the budget. If you don't spend the budget, that's a different issue. But otherwise, there is no one. Well, now they started, and I think that should increase. All India Institute for the first time is looking at cost of care in a government institution, and I'm not so sure that we'll be privy to that information, but what I've been told privately is that their cost of care is higher than ours in certain of the higher tertiary care areas. So that was comforting, but it's not good, because the fact that CGHS looks at certain parameters, and everywhere in the world, the simple thing which is taken is that the way you reduce healthcare costs is to reduce prices. And no one has actually looked at efficiency and effective models to actually maintain lower costs. If I was speaking to a clinical forum of doctors, I would address them and say, you are responsible for rising healthcare costs. And of course, all of them would be very upset by that. Why? Because as a doctor, I can order an MRI, an ultrasound, a CAT scan, and an X-ray to make the diagnosis of the single disease. Right? So I should be actually using the least expensive, most effective test to arrive at the diagnosis. If we demonstrate those kind of systems in place, our cost of rising healthcare will be reasonable. Right? In the US, healthcare costs are exorbitant because physicians there practice under what is called malpractice litigation concept. So they want to make sure that they don't miss anything, so that in case something happens, the lawyers don't take them to court. Right? That's peculiar. There's also a revenue generated. In our country, because a large amount of private healthcare is in the smaller areas, etc., it's a revenue generated, it's a revenue driven system. It's not quality driven. And for quality driven systems, you need clear, transparencies, you need clear accountabilities, you need a measurement matrix. This is where I believe systems which can actually keep confidential data and not have a bloodbath out there, but the aspect should be more on the prospect of learning and improvement, can create models where private-public partnerships can be of value. I think that there's increased access in areas of operations. We can read radiology. We have 8 hospitals with 4 more coming up outside. I've taken a cue that I'm not going to hire the same degree level of radiologists in all the hospitals. So we are going to transmit the images through PACS and RIS through the remoter hospitals, which will have radiologists, but the MRI guys and the CT scan guys and the other big degree guys are in 1 or 2 of our hospitals who will report these studies. And that's an advantage. And I think that that's something where private-public partnerships could be of value. And of course, the most important thing is that we should be cognizant of the fact that healthcare is not only about providing care. Right? It is about education, it is about research, it is about patient-public awareness. Right? And I think these are the areas where we can easily partner without anyone getting hurt in any way to improve what we need to. We do lack in that, and I think that's an important thing. There are a lot of very successful examples of PPP partnerships. You've heard the one in Gujarat. It's not mentioned here because that started way before these started, and I think they're very respectable models in Gujarat. What they did in Gujarat actually didn't succeed in some of the other states, and that may have its own issues. But the good thing There are 300 hospital facilities. The government felt that there's a need for cancer, for orthopedics, and that is trauma, cardiac, and neurosciences, plus all the other subspecialties. So we built 300-bed hospitals. We have LINACs. We have the whole. They are our hospitals, right? We give the government a certain percentage of the revenue every year. The government takes that money and through an insurance company covers 400,000 covered lives of poor people in these hospitals. Those patients can come and access care in our hospitals for all their ailments which they need, for, without having to pay anything, and it's paid through an insurance firm, much lower rate. Thereby it provides viability to the hospital. Our rates are much lower than all other institutions. The services are as good as anywhere else. I think it's a great model. If that works, it's an opportunity for a model to look at elsewhere. Similar schemes have been done in Karnataka, etc. So there are opportunities for a variety of private-public partnerships. And I think we in the private sector have to be part of the solution of, let's say, the problem of inadequate, unaffordable, not accessible healthcare in this country. Thank you.